want to close by speaking to some of the training opportunities for becoming psychedelic-assisted therapists or even prescribers of psychedelics within an interdisciplinary treatment model or supporting psychedelic-assisted therapy. I do believe interdisciplinary teams should engage in training for all roles, and very importantly, for the role of therapist. I've mentioned a number of different training programs. At Numinous, I have spearheaded and led the development of an 8-week fundamentals of psychedelic-assisted therapy training program that is in part live with 3-hour sessions weekly and in part self-directed learning with online content in a learning system online. And I think that this training is certainly an excellent start and part of a larger certificate program that Numinous has been developing and implementing. There are a lot of various training programs, some in-depth, some very rich and comprehensive, others less so. And the quality of programs is probably quite difficult to gauge at this stage because there haven't really been too many training standards at this stage developed. I mentioned Oregon earlier is developing some standards for training and training equivalency for the exemptions in that state related to plant medicine use for healing and well-being. But overall, it's important to understand that at this stage, regulatory authorities that govern healthcare providers like the College of Physicians and Surgeons or the boards of medicine in the US and in other countries, like nursing associations, like the associations of therapeutic counselors, clinical counselors, psychologists, all of these regulating bodies, there haven't been many steps yet towards setting regulatory standards because these therapies are quite nascent. They're really just in this process of coming off the research bench and into clinical practice. There's been a lot of interest, a lot of hype, a lot of excitement and push to get these therapies into clinical practice. And I do believe that there is need for a concerted effort to bring this forward in a timely way because there are many people suffering. However, we also need to make sure that we have checks and balances and that it doesn't happen in a rushed way or in a way where it's just being kind of shoehorned or pushed into the current dominant system as it is. As I've mentioned a lot in this presentation, we need to think about how overall our dominant systems of healthcare need to shift away from being racist, from being predominantly informed by white research agendas, white male-dominated research agendas, and models that are much more inclusive, that are safe for individuals seeking care, and that work together with different groups, communities that represent different intersectionalities to create truly a system that is a welcome and safe space for all. And it is my hope that we can do that as a community in bringing psychedelic-assisted therapies forward. And as we do that, shifting our healthcare system instead of trying to put these therapies into a healthcare system that puts all the emphasis on the drug and pharmacotherapeutic models, as opposed to understanding some of the more nuanced aspects of the importance of context, environment, and all the other things that I've spoken to in this presentation, as well as Indigenous knowledge systems have known since time immemorial are important for human well-being, connection, and thriving. So regulatory bodies have a lot of work to do, a lot of learning to do, and it is my hope that experts like myself and others, those of you that may be listening or watching and learning a lot and expanding in this field, can come together to really push that policy and regulatory framework forward in a good way.
This mini lecture is part of Numinous' Introduction to Psychedelics, which is a free course where we explore the world of psychedelic medicines and their potential as therapeutic tools. Check out the link in the description for more info.